Hey guys, welcome back to Film Title. Today we'll talk about the most nauseating moments on Dr. Pimple Popper. Let's head into it. Number 1. Scoop a cyst out. Dr. Pimple Popper is well versed in a variety of surgical instruments, ranging from scissors for snipping lipomas to blades for cutting cysts. Celebrity dermatologist Sandra Lee used an unusual equipment on Monday night's edition of her show, a spoon. That's because she was tasked with treating Marty, a 51-year-old man with a 30-year-old epidermal cyst on his shoulder that had already burst. Marty admitted that he had considered busting the cyst himself throughout the years, but had never consumed enough tequila to do it. Marty explained, "It's simply that I don't know how deep I need to cut it." According to Mayo Clinic, an epidermoid cyst is a form of cyst that develops when skin cells burrow and grow beneath the skin. Epidermoid cysts usually grow slowly and are not pleasant. Marty's cyst, however, exploded a few days before he could see Dr. P, and the cyst contents hardened on top of the skin, making it difficult for Lee to determine where the growth began and stopped. Lee used the spoon to scoop up the remaining pus without damaging Marty's still intact skin. Dr. Pimple Popper compared the substance to creme brulee and flan afterward. Dr. P informed Marty, "I might have to name the spoon after you." Lee's plan didn't go off without a hitch. Marty kept grunting and squirming around throughout the treatment, giving Lee the impression that he was stressed or in discomfort. As a result, for the first time in the history of Dr. Pimple Popper and Lee's profession, she allowed a patient to smoke outside during a procedure. Lee was able to finish removing the pus and sew up the wound so it could cure once he returned. After that, he never returned for the next checkup. Marty hasn't been seen almost 3 months. I haven't been able to contact him, but I'm assuming he's fine, with the cyst growing back and is celebrating with tequila somewhere. Dr. Pimple Popper stated the following. Number 2. Super fat lump. After noticing an apple-sized lipoma on his sister's shoulder blade, one of Dr. Pimple Popper's admirers sent her to the celebrity dermatologist. Sandra Lee detailed her treatment in a video posted to her YouTube account on February 17th. Dr. P used an injection to numb the woman's shoulder blade area before making an incision through the lipoma center to drain its contents. A lipoma is a fat-filled tumor that develops between the muscle and the skin. Lipomas usually grow slowly and are modest, with a diameter of around 2 inches. A lipoma is usually not cancerous, but if it hurts or irritates the person who has it, a dermatologist can remove it. A lipoma's yellow fat deposit protruded from the incision almost immediately. When it began to bleed, Lee used the cauterizing pen to seal up the microscopic blood vessels beneath the skin, preventing more blood from leaking. She claimed that by going through this procedure, she was able to perceive the progress more clearly as she worked on it. Dr. Pimple Popper then pushed around the fat deposit with her gloved fingers, loosening it from the woman's skin walls. She was then able to squeeze around the incision, causing the lipoma to pop out. Lee remarked, "It's like you're having a kid," alluding to the big chunk of sticky fat. Lee then advised the woman to take a picture of the fat mass to show her brother, pimple popping fan, how it looked. Number 3. Pillar cyst. Pillar cysts are the most frequent type of cyst, and they most commonly appear on the scalp. According to the National Institutes of Health, pillar cysts affect less than 10% of the population and are usually non-cancerous. When keratin, a protein contained in skin cells, is removed from beneath the skin, it appears as a thick white liquid. These tumors aren't inherited, according to Lee, which explains why the sisters were the first in their family to develop pillar cysts. Their identical genetics, on the other hand, could indicate that they have similar skin types, which, according to Lee, could explain why they both had the skin problem. Dr. P began by injecting a numbing medication into each of the 3 cysts. She cut right through the core of the largest cyst, behind Tracy's ear, which immediately ejected a grayish-white substance that looked like mustard. Lee was able to get rid of the rest before moving on to the next one, which had a more oatmeal-like texture, but erupted in the same way as the first. When Dr. Pimple Popper started treating Tracy's final growth, she remarked, "Brace yourself for impact." Lee was able to successfully remove the cyst and sew all 3 up after even more spurting. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.